Good day, everyone. Welcome to Partners in Health and Biz. I'm your host, Gail Dixon McBride, and I'm so very happy that you could join me today. I'm also your natural health consultant. So today on this episode of Partners in Health and Biz, we will discuss different reasons why even smart and mentally healthy children sometimes misbehave. You will also learn when you may need to get professional help to keep your child on track by identifying red flags and various signs. So, my guest today on Partners in Health and Biz is Dr. Kim Jones Fearing. She is a board certified licensed psychiatrist in the state of Maryland with over 20 years of experience treating mood, anxiety, and substance use disorders.
Mm.
When meeting with clients, she ensures that adequate time is built into each session so patients feel involved in the treatment. Dr. Fearing uses evidence based and ultra modern talk therapy such as cognitive behavior, psychotherapy, and motivational interviewing to get to the heart of the problem. She prescribes medications only when necessary to reduce suffering and to help quicken the recovery process. Dr. Fearing believes in including the patient and their loved ones in the process as much as possible so that they understand the benefits as well as the limits of medications. Reducing the need for excessive and complex medication regimens is actually one of her specialties. Dr. Fearing, I'd like to welcome you to Partners in Health and Biz. Thank you so much for being my special guest. How are you?
I'm doing well. I'm enjoying the summer.
Yes, I am too. Trying to stay cool, trying to hit the swimming pool as often as I can.
Hmm.
But so Dr. Fearing, yes, I'm so happy that you're my special guest today because my listeners want to know. There are so many parents and grandparents that have some actually perplexing questions regarding child rearing and behavior management.
Hmm.
And so many parents today are at their wits' ends when it comes to disciplining, correcting, and even managing their child's bouts of ongoing behavior. And you know as well as I do, we hear and see incidences I've seen in the grocery store, for instance, little children, 2 to like 6, 7 years old, even
Hmm.
having temper tantrums.
Hmm.
They're they're acting up in the grocery stores, restaurants, public indoor and outdoor events. And we know that parents, as the child ages, sometimes we get these children and they have their smart mouths in middle school. And when by the time they get to high school, they are simply out of control.
Hmm.
So, in your professional experience, Dr. Fearing, what are some of the causes of these uncontrolled outbursts, tantrums, and blatant disrespect in each of these three age groups?
Well, there are a multitude of problems, and for each child, there's millions of different things that can cause the behaviors. And and I think it's helpful to start any discussion about children's behavior by talking with the parents about honestly, how is your child's behavior affecting you?
Mm,
And how does it make you feel as a parent when your child is misbehaving?
right, right.
And was there ever a time when you felt better about how you and your child um, were getting along?
Mm-hmm.
And you know why I want the parents to ask these questions of themselves is because most of the time when children start behaving badly or out of control, um, first of all, parents don't realize how badly they are affected by their child's behavior, how embarrassing it is,
Right.
and how hurtful it is,
Yeah.
especially if they're smart mouth and they say things that basically hurt anybody's feelings. And similarly, children don't know how badly that that they don't understand how badly they affect their parents when they behave
Right.
badly,
Hmm.
and children don't always really know what they're feeling. They don't understand that they're feeling angry, so they smart mouth their mom, and they don't understand that they may not understand that they're feeling sad, so you know, they say they want to hurt themselves at school when they really didn't want to hurt themselves. They really wanted someone to talk to them.
Okay. Okay. So back to these crying spells, temper tantrums, and disrespect. For, say, the 2 year old through the 6 year old, what are some of the ways that parents can talk to their child, or how can they, what can they do to try to turn this behavior around so that it's not an ongoing, constant episode every time? I know children are going to be children, and it's not like we're going to stop our children from ever misbehaving. But some children and some parents are finding this to be an ongoing problem. What are some of your suggestions for the 2 to say 6 year old child who's having these outbursts and temper tantrums?
Well, um, a lot of the problems are, um, a lot of the problems come with what we really expect. Do we really expect a 2-year-old to say, you know, I'm having a moment right now, and what I need to do is take a deep breath, step back, and I'll drive and meet you at the grocery store later. You know,
Right. No,
and
they're not going to do that.
nobody expects a 2-year-old to say that and then get in the car and drive to the grocery store at a time when they're feeling better. So a lot of what the problem is, there's a mismatch between what we expect from our children and what our children can really handle. And
Mhm.
then there's also sometimes the parenting style may be such that the child is being allowed to do whatever they want to do, regardless of how inappropriate their behavior is. And
Right, right.
that's not that's not always the best way of training the child about the best ways to behave either.
Mhm.
So, like for instance, how many times have you gone to church and there's a child somewhere in the church crying?
Right.
Okay, that's normal,
That's normal.
healthy behavior for a baby.
Right.
Now, for a 12 or 13-year-old, there may be an issue there.
Okay. Right, right. Especially if they're having temper tantrums. Right.
Right. So,
Okay.
children, sometimes they're tired, they're sleepy, they're stressed because parents may have been rushing to get to church, or they just wanted to stay home with Nana. And and anytime or sometimes they actually might have a little fever and no one notices. But whenever children are uncomfortable, that's their way of communicating, and we all know that. And when it gets to be problematic is when the behavior continues even when all of the other children are now they're used to going to church and sometimes even like it and ask to go.
Right, right,
But your child is still fussing and not really responding in a healthy way. So sometimes children are able to grow out of these things, and sometimes your child may have a difference somewhere. It doesn't mean that it's not treatable. It might mean that most of the time these developmental differences can be handled by by helping the parents understand better um, what they can do to help help modify the environment so that they're comfortable, so that the child's comfortable.
right.
Child
Mhm.
won't cry at church if they know every Sunday they're going to go to church and that um, and that and that their parents are going to make sure that they are fed and their diapers are changed and the child knows what to expect.
Right, right. And then I know we have 6-year-old twins, and we take them to church. But one Sunday, but we take them to church and then we let them go to children's church because we know that 6-year-olds, we don't expect them to sit through an hour and a half of preaching. So, but recently we took them to church and they had canceled children's church. And we were like, oh my gosh. But I was really surprised. They were very well behaved considering. But what I did, I asked one of the ushers if they had some paper and ink pen so that they could draw and something to distract them while the preacher was preaching because in and out, of course, they're listening, but not listening. And so we gave them some paper and pen and they drew and they sat there and they were really, really very well behaved because I understand that no one expects certain age groups of little children to sit through a sermon. And so I found that out and I basically knew that. But in the future, if that should happen, I'll come prepared.
Mhm.
So, Dr. Fearing, so in the case of, say, for instance, a parent has tried everything, they've tried spankings, punishments, sending their child to Big Mama's house, and, and that didn't seem that just didn't seem to work because I know even for middle-aged children, sometimes they feel like the parents feel like, well, maybe if we send them and put them into a different environment, send them
Mhm.
to grandma's or grandpa's or
Mhm.
Aunt Sally's, maybe this will help. They
Mhm.
just need to get away from us sometimes. So,
Right.
do you have any suggestions for the, say, middle school child
Mhm.
who is just maybe acting out and being a little disrespectful, and
Mhm.
you've done everything you could possibly think of? What would
Mhm.
you suggest?
Well, a lot of times what people forget to do is they forget to ask the child what's going on.
Hmm.
Uh, and sometimes you can you can start a conversation like that, not when at the time the behaviors are happening, but at a time when they're calm the next day or later in the day when they're calm and they may be watching TV or whatever. And ask them, remind them, you used to be so well behaved and we never, we never experienced you yelling at us like that or or saying bad words. And what we want to know is, has somebody been bothering you at school? Is somebody bullying you? Is someone treating you mean? Um, and or anywhere else? Have we been too hard on you?
Okay.
And see what the child says.
Mm.
That's a good place to start.